Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to healthcare. This week we hear from Bridgett Robbins. She's an assistant teaching professor at the Sinclair School of Nursing, but before that she worked as a nurse in mid-Missouri for more than 30 years. She spoke about how the past several years of fighting the COVID-19 pandemic has impacted her and those she works alongside. As a note, this piece discusses the pandemic, grief, and death, and may be distressing to some listeners. Here's Bridgett.
We didn't let family members come into the hospital who had dying family. That's stressful. The nurses were stressed out about that. It's very sad to hold somebody back that needs to be with their family, definitely when they're dying, but even when they're sick and in the hospital. Like, you want your family around you, and nurses want patients to have their family around them. So again, one more layer of stress, and going home feeling a little bit sad and powerless because you can't help that situation. But to flip that on a more positive side, there was a lot of creativity, and different staff decided that they would help FaceTime, or during if a patient was dying, they would have a Zoom meeting, and they would let their family be there singing while their family member was struggling through the last hours of their life. So that added a little more workload, and probably another reason why many nurses were like, "Ooh, I've had it. I need a break." And so they stepped out. I hope many of them will step back in, but some of them just decided to retire early. I know a nurse that's been a nurse for 20 years who's never had a death. Yeah, she's a pediatric nurse, and she's never had a death. I'm so happy for her. I'm a nurse that works with adult patients and geriatric patients, and it's not very unusual once a month for me to experience having a patient experience a death. But for someone that isn't used to a high incidence of death, suddenly being exposed to that kind of situation, that would be very stressful and mentally stressful. And if that's not one of your fields of expertise or comfort, if you will, that did have some impact on staff that worked there. Staff get stressed out and they need help to negotiate their wellness and health and how to get through that situation. And so I think it's been recognized in the past that this is important, and healthcare workers have feelings too and need to be, concerned about their mental health. But I believe that there are more and more resources becoming available, and I think it's coming to light that it's not just a nice luxury to have, that it's necessary if we want to keep our staff healthy and thriving and wanting to come to work and continue taking care of patients the way that they did when they first entered their profession.
That was Bridgett Robbins, a longtime nurse and an assistant teaching professor at the Sinclair School of Nursing, speaking about how the COVID-19 pandemic impacted and continues to impact nurses. That's it for this week's Missouri Health Talks, which was reported and produced by Jaden Harper. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.